Not getting your health and wellness questions answered at your doctor's office? Are you ready to take control of your health and well-being? Do you want the proper tools to set you on your wellness journey? Do you want to meet and chat with expert members of the healthcare team? Well, step into Real Time with Dr. Stacy. Hi, I'm Dr. Stacy de Gale, your personal physiotherapist and wellness consultant who wants to make sure that you live your best life. We'll be chatting with wellness team members and inviting you as you are the center of that team. And we'll be doing all of this while you are in the comfort of your own home or office. Join me in Real Time with Dr. Stacy as we discuss everything health and everything wellness. Hi everyone, and welcome to Real Time with Dr. Stacy. It's always a pleasure to be here with you to share information from our local experts. Quite often, we always believe that we have to leave the shores of Trinidad and Tobago to get good information, to get good healthcare. But we have our persons right here. And it's with great pleasure that you are joining me today for our chat on breast cancer and physiotherapy. Now, many times when we think about physiotherapy, we think about sports, we think about massage, we think about, just walking a patient. But physiotherapy is such a broad profession with such a very wide scope. And physiotherapists are vital members of the healthcare team for persons living with breast cancer. And I say vital, not because I'm being biased, because I'm a physiotherapist, but the reality is that through medicine, we are prolonging the lives of those who have been diagnosed with breast cancer through improved surgical procedures, through improved chemotherapy and radiation procedures. However, physiotherapists are responsible for getting back a certain quality of life. So, for example, I had a patient this week who came in for back pain, but taking a history, she was a breast cancer survivor who had mastectomy, meaning she removed the breast. She also had chemotherapy and radiation, survived, a survivor for 10 years, but she's unable to lift her right arm. And that was the side where the breast was removed. And when I asked if she was referred for physio, the answer was no. So I got a bit perturbed because the surgeons and the oncologists did their work. They did a fantastic job. However, they have forgotten that this patient has to return to combing her hair, to reaching into a cupboard. She's a teacher using the blackboard. And so her quality of life was negatively affected, even though she survived the actual cancer. So this is one of the major roles of physiotherapy, to ensure that breast cancer patients have returned to a good quality of life as far as is possible, that we prolong your life because of prescribed exercises, and we can also prevent breast cancer through the prescription of exercises by a physical therapist or physiotherapist. Now, we are carded today to have as our guest Dr. Kamla Ramdath-Cumming, who is a friend and a colleague. She's a physiotherapist with over almost 24 years experience. She is a certified lymphedema therapist since 2009, and even better, she's a mother. So we have this extra caring layer that propelled her to not only be a physio, but to continue her services through the provision of lymphedema care. And for those who may have been diagnosed with breast cancer and have had breast cancer treatment, you know that when we speak about lymphedema, we are speaking about that swelling that can happen in the arm, the chest, the neck, and even the legs in some breast cancer survivors. That is not the regular swelling you get if you twist your ankle, for example. We are supposed to have her on. However, we are having some major technical difficulties. So I'm a little sad. We've been trying for the last actually 40 minutes to get online, and we keep getting bumped off. I think because there was some heavy rains in certain parts of Trinidad, and it has affected the internet connection. So we unfortunately will have to cancel Kamla's part of the show. I'm going to stay on just for a few minutes for us to chat a little bit about breast cancer very briefly. I don't want you to come on and think that you're leaving without anything. For those of you who are online, I see there are some people online. Please feel free to comment, ask any questions if I can answer. If I cannot, I will get the information for you. But October is Breast Cancer Awareness Month. It is internationally recognized. And why is that important? It is important because 1 out of every 9 women will be diagnosed with breast cancer. And that is a scary number. In Trinidad and Tobago, that number is actually 1 in every 8 persons, I think, in the latest information that I was able to gather. So it means that if you just look around your workplace, for example, at least 1 person in your office will be diagnosed with breast cancer at some point in time in their life. And so it is the most common cancer in women in Trinidad and Tobago. So we must be concerned because it can be prevented, and through early detection, we can also minimize the negative effects of cancer, and you can live a wholesome and full life. Sometimes we get these diagnoses and we start to panic because we start to think of the funeral, we start to think of the coffin. But there's a 99% survival rate if your cancer is identified early and if you take the necessary steps to protect yourself and to get treatment as early as possible. So check your boobies, guys. We have to check our boobies. And it's not just for the women, it is also for men. Breast cancer also affects men. So for these shows, sometimes I get a lot of women, it's breast cancer. So most of the guests, the viewers are female, but I'm encouraging the men out there to also take part, to also to listen and to learn, because you may also be a victim, but you also have a mother, you have sisters, you have daughters, you have wives. So it is information that all of us must be aware of. So in Trinidad, it is the highest form of cancer in women. It affects 1 out of every 8 women in Trinidad and Tobago. And there's a 99% survival rate if we catch it early. Physiotherapy is vital in the management of breast cancer. As soon as you are diagnosed, you should be referred to a physio. During your treatment, you should be having physiotherapy. And after, to ensure you survive, and not just survive, but that you live and you live well. So again, I must apologize for technical difficulties. This was going to be such a fantastic show. So we will let you know when we are going to come again with Dr. Kamla Ramdath-Cumming, who is a physiotherapist of 24 plus years experience, who is also a certified lymphedema therapist, because we must protect our health. We must learn how to manage our lives better and to have a return to a good quality of life. It is not just about surviving, it is about living. And physiotherapists are a vital part of that equation in ensuring we manage your pain, in ensuring we prevent weakness and stiffness of your joints, to prevent the development of osteoporosis or brittle bone disease, which can happen because of the medications you will use when you have been diagnosed with breast cancer, to prevent that excess swelling in the arm, to improve your function. And let me tell you, prescribed physical activity and exercises by a physiotherapist has been proven to reduce other complications such as nausea, brain fog, fatigue. It helps also to boost your endorphins so you feel better even with your treatment. There's less risk of depression. So physiotherapy must be a part. So if for some reason you or someone you know has been diagnosed with breast cancer and you have not been referred to a physiotherapist, please ask your doctors to do so, because we are playing a part in your survival and in improving the quality of your life. And Prescribed exercise has also been proven to prevent the occurrence of breast cancer by over 30%. So you can prevent breast cancer by being physically active. So all of us, no matter your size, because some people feel you're only exercising to prepare for carnival. Some people believe, well, I'm skinny, I don't need to exercise. Exercise has nothing to do with your size. It has to do with your health. It has to do with promoting healthy living. I know many persons who are slender and they're skinny and they're very svelte, but they're alcoholics, they're chronic smokers, they don't sleep well, and they suffer from a host of conditions. So we're not talking about size here. Yes, we want to reduce the obesity epidemic, but we want to be healthy, no matter your size. And so we all should be exercising for at least 150 minutes per week. So let's just say about 30 minutes every other day. It's not too hard. Moderate intensity. If you have other conditions that are preventing you from exercising, simply speak to your doctor, get your physiotherapist to guide you. And then, depending on your status, we will put you on to a well-qualified trainer who will continue your journey into health and fitness. Exercise is vital in the prevention of breast cancer, in the prevention of prostate cancer, in the prevention of diabetes, hypertension, and I could go on and on and on. So do not take it for granted. Start exercising. If you have had a relative who has suffered from breast cancer, especially if it's on the side of the mother, you are at higher risk. So ensure you speak to your doctor about when you should start your screening. And check your boobs. I can't say it over enough. Know the contour of your boobs. Can you see my boobs? You're not seeing it well enough. Boobs. Check your boobs every month, at least once a month. Do your personal check. Know the morphology of your body so that when you go to the doctor and say, listen, I am feeling something that is different, they can take the steps and guide you as to what may be next. Because not every lump is cancer, but we have to be aware. And we have to be able to prevent. So get your boobs checked, self-checked once a month. Speak to your doctor about how often and when you need to do your mammograms. The guidelines generally, once you're 40 and over, you should have a mammogram done, whether it's once a year, once every 2 years, depending on your risk. But there's a school of thought now that suggests that if, for example, your mother suffered with breast cancer, and let's say she suffered at 45. One of the schools of thought now is that you start doing your mammograms at 10 years before mom had it. So if mom had it at 45, it means you start to need checking via mammograms at 35. There are other ways as well that, depending on your risk, depending on how you present, the doctor may also suggest a specialized type of ultrasound to confirm if there's anything to be worried about. And again, you must have these conversations with your doctor. Anything that is not sitting well with you, don't be afraid. Go to your doctor to get some peace of mind, because not every lump is cancer. However, you have to be wise. I had a patient a few weeks ago who has a high risk of breast cancer, and I asked her if she has ever done a mammogram. She's my age. I'm 46, by the way. And she has never done a mammogram. And her mother suffered with breast cancer and an aunt. And I said, well, why are you not going to do it? Let me tell you what she said. It will hurt. Everybody who does a mammogram says it hurts. Listen, if your boobs hurt you just for a few minutes to save your entire life, we could take a little bit of a soreness. So I don't want to hear anybody saying they don't want to have their mammos done because it hurts. I don't know if I have a high pain tolerance. When I do my mammograms, I get no pain because I have some of the best radiographers. I know some of the best radiographers in Trinidad and Tobago, and they're always gentle. Sometimes, yes, you'll get discomfort. When you get home, you can apply some heat or some ice to soothe it, but a mammogram and other ways of early detection can save your life. So ladies and hopefully gentlemen who are viewing, again, thank you all so much for coming on. I apologize again, but we're having major technical difficulties. So unfortunately, We will be rescheduling this event, hopefully within the next 2 weeks, where we are sure that our internet connection will be secure, because Dr. Ramdath-Cumming has so much information to share with you on the value of physiotherapy in the breast cancer management team. And again, I cannot re-emphasize enough that with all the advancements of treatments for breast cancer, which is all well and good, it doesn't make sense that you survive, but your quality of life is poor. And that is our role and function, to add years to your life that are full of quality. So, guys, join me soon. Thank you so much for those who are on, who stayed for the few minutes. I just had to give a few tidbits. This is October. This is Breast Cancer Awareness Month. But this is just a month to remind you that every month is Cancer Awareness Month. And you must check your boobies, do your necessary checks, exercise regularly, have a balanced diet, balance everything in moderation, minimize alcohol consumption, cut out the smoking, and we will live longer and healthier lives. So, guys, you all stay well, take care until the next Real Time with Dr. Stacy, where we will have our guest, Dr. Kamla Ramdath-Cumming, physiotherapist and certified lymphedema therapist. Take care, guys. Bye. And check your boobies.